Many people are searching for relief from migraines. This affects more than 29 million Americans. With us here today is Lori Golden, a certified massage therapist, yoga instructor, and holistic health educator. Welcome, Lori.
Thank you, Lisa.
So I know you're going to share with us some self-care techniques for migraine relief, but can you explain to me the difference between migraines and a headache?
Sure. Actually, a migraine is very different from a headache, or what we would call a typical tension headache. And a migraine actually occurs on one side of the head, usually around the temple or behind an eye, and has much more severe symptoms. So people usually experience nausea, sensitivity to bright lights and sounds, and the migraine can last several hours up to several days.
Wow.
Yes.
Does it run in families?
Actually, there is a genetic component. So if you do have migraines, you might want to look and see if there's somebody else in your family that has a history of migraines.
Now, I think I know the answer to this one, but I'm going to ask it anyway.
Okay.
Is there a cure for migraines?
Actually, there's no cure, but there is help. There are things you can do.
Tell me about that.
Okay, so the first thing I suggest is to go see your doctor and talk to him or her about your symptoms and if there is that family history and what treatment options are available.
So what can I do at home?
Well, once you're at home, there are several things that you can do to help manage, cope with your migraines, and hopefully even prevent them.
Give me an example.
Okay, so two things I suggest are relaxation techniques, and two common ones are self-acupressure and guided imagery that you can do at home.
Wait a minute, acupressure? Does that involve needles?
No, actually that's acupuncture
Okay.
that uses small needles, but acupressure actually came first, and we use pressure of the fingertips onto the points along the body that help reduce tension and induce the body's own natural relaxation response.
That sounds great.
Yes.
What about the guided imagery then?
Okay, so guided imagery is a visualization technique that guides your thoughts and your senses toward a more relaxed and focused state.
Okay, well, I'd love to learn about that.
Good.
Can you give me a demonstration?
Sure. Actually, if you'd like here, I can show you two acupressure points that are very helpful for managing migraines, and I can demonstrate on you and then show you how you would do that at home.
Let's do that.
Okay, great. So the first point I'm going to show you is on your hand, and even though this point, Lisa, is located away from your head and where the migraine pain would be, it's an anti-inflammatory point. So that's really great for migraines when there's swelling of blood vessels causing the migraine. The only time we don't want to use the point on the hand is if you're pregnant or showing a friend or family member that's pregnant. Otherwise, completely safe to use throughout the day for this. Okay? Great. So I'm just going to take your hand here, and you're going to take your thumb and index finger together, and you're going to look for where there's muscle or skin bulges out here. You see that?
Yes.
Okay, so you're going to take your other hand and place your thumb right at that location where the skin bulges out. And then you're going to take your thumb and index finger apart and press into that location. Good. Now you're going to press in toward the base of the bone here of the index finger. You're going to take your other fingers around and wrap them around the pinky side. Turn your hand. Good. Now you're going to relax the hands into the lap. Relax your shoulders and your elbows and use the pressure of your thumb into that point.
Okay.
Now, if you do have a migraine, Lisa, this area might feel a little sore or achy or tender, and that's an indication that you're on the right spot. You're on the pressure point. If you're not sure you're on the spot, you can sort of press and feel around a little bit in that area until you do feel more of that soreness.
I think this is it.
Good. So then from here, what you're going to do is take a nice long breath in through the nose and then out through the nose, and pressing the point. Good. So this combination of deeper breathing and pressing the point is going to help encourage that natural relaxation response of the body that we want to help reduce the pain of the migraine.
That feels good.
Good. So you're going to do this at home for 1 to 3 minutes and then relax from the pressure, and then you can come back to it again.
Great. Okay.
Good.
Now you mentioned a second point.
Yes. There's actually another great point for migraines that's actually located behind the head, so if you'd like, I can show you that as well.
Sure.
Okay, great. Let's do it.
Good.
Okay, Lisa, so this next point is located at the back of the head, and I'm just going to find it for you first and then tell you how you can find it on yourself.
Great.
Okay, so I'm going to place one hand on your forehead here just to support the head. My other hand is at the back of the neck, at the base of the neck here. You're going to tilt your chin down, good, and I'm going to slide my fingers up the neck to the base of the skull, and go ahead and tilt your head down for me a little bit more, good. And then I'm going to feel toward the back of the head for these pressure points that are located up underneath the skull into these little hollows or indentations at the base of the skull here. So my thumbs sort of naturally fit up in underneath. Do you feel that?
I
Good.
do.
So I'm going to direct the pressure now toward the center of the head as if I'm pressing up toward the forehead. Okay, and again I use gradual, steady, firm pressure of the fingertips, and you're going to breathe deeply in and out through the nose. Again, that combination of the pressure and the deeper breath signaling the relaxation response to begin. Good. Then I'm going to gradually remove my fingers here in the pressure, and for you to find it, you're going to take your hands behind, reaching with your thumbs up underneath the skull. Good. Tilt the head down a little bit and then reach up. Excellent. And now you can go ahead and take the thumbs out a little bit more. Good. Right here. Now bring the head up and let the weight of your head drop into the thumbs. That helps create the pressure so you don't have to use so much strength in your thumb joints. Excellent. Good. And then you would breathe. Good. So how did that feel?
That was terrific.
Great.
How often should I do this?
So what I would recommend is that if you do have migraines quite often, you would do this every day, because this will help release any tension in the neck or shoulders, and sometimes that can be a cause in and of itself for migraines. Okay, so I would do it every day. You could also do it at the onset of a migraine to hopefully reduce the severity of the pain from the migraine.
I'm anxious to try these. Thank you.
You're welcome.
Well, what other resources can you offer?
Well, we have lots of resources through Hill Physicians. So if you visit us at hillphysicians.com, we have tip sheets available. We have guided imagery in the form of downloadable podcasts. Both of those are free. And we also have a free teleclass devoted to migraines. So in that class, you would talk to an expert instructor, a pharmacist, you learn more relaxation techniques and things that you can do on your own for self-care.
Thank you very much.
You're welcome.
Coming up next, Lori will show us how to use guided imagery to manage migraine pain. You won't want to miss it.